thank you so much for that introduction, everybody. And how's it going? Good to see you. So this presentation is highly interactive, and I want to know where you're all tuning in from. So we're going to use the chat feature throughout the entire talk. So comment down below where you're tuning in from, and I'll give you a shout out too, because this is how we're going to do this. So welcome to Pain, Go Away. These modalities are here to stay. And I think this is a great, what's so good about this talk is the fact that I'm going to be sharing all the latest and greatest things that I have learned and have integrated into some of the practicing that I do. Being the Chief Veterinary Officer here for the Fetch conferences in DVM 360, I just counted yesterday. I sat in 2,102 hours of continuing education because that's what I organize now as the chief. So you think I would know things? I probably don't, but it's okay. But I'm here to share some of that information with you. We got Martha here, Mary's from Pennsylvania, Lawson's from Somerville, South Carolina, or Amanda's in Orlando. I'm going to be there in a few weeks. I'm a Disney fanatic. Martha's in here, Mariposa, California, Seattle. Good to see everybody. Thanks for joining us. Good to see you. All right, let's get into it because we got a lot of fun stuff to cover. But first, I got to show you my kids. So I know we already got the intro already, but this is our Christmas card. And I mean, if you want me to send you one, I'd be more than happy to send you one this year. But look at my family, you guys. I mean, they're my why. And I always say this to vet students when I lecture on stage, to my colleagues, and to you tuning in. Always remember what your why is here. Why are you here? What's your purpose on this earth? We are veterinary professionals. And this is my why, is because I want to be an empowered veterinarian and empowered pet parent so I could be the best to all, not just my fur babies, but all of them. So there's Chelsea, Connor, Carl, and the little guy in the sleigh that he slays all day, every day is Clark W. Griswold. So there's a rumor that we might be getting a fifth dachshund. So if you're following me on TikTok live stream, I'm getting peer pressured by my followers. There is one that is available. It's a wire hair dachshund female. She's standard. These are all minis that I have. And look, I'm sweating just thinking about it because I love her so much. I saw the picture. So in the chat box, give me some names that begin with the letter C for girl names, because what are your thoughts on the name? I have a few picked out, but I want to hear your thoughts too. So I have Cordelia, we have Churro, and we have Cannoli on the list. These are the things that keep me up at night too. So I would love to know your feedback of some names. So Clarissa, I hear, oh, that's a good name too. Charlotte's another good name. Oh, all right, well, we're gonna have to see. All right, everybody, so marinate on that. That's your homework assignment. So DM me while you're thinking about this too. I'll put that at the top of your inbox tomorrow to give me names of my fur babies. It's okay. All right, so give me a comment down below, yes or no. Do you agree or disagree to this statement? There is often a disconnect between pain perception from the veterinarian and the pet parent. And I'm going to say that one more time. Put in the chat box, yes or no, if you agree with this, that there is often a disconnect between pain perception from the veterinarian and the pet parent. Because, I do find that when I'm practicing, sometimes we think that age is a disease. They're slowing down. That's how it's supposed to be. We perceive things differently. And then we might have a pet parent that's way out of left field that's saying, no, Dr. Christman, I disagree with you. She's not in any pain. My cat is, how do you know, Dr. Christman, that my cat is in any pain too? I get that a lot. So Stephanie says, agree. Grace, Cindy, Heather, you're all saying yes. So yeah, there's like and I agree. So there really is that. So how do we come together so that way we can give and empower our pet parents with the tools that they need to better serve their dogs and cats to make sure that they have that long, glorious, healthy life going forward? So oftentimes pain is perceived as a behavioral issue. Now, some of you know our good friend and colleague, I love him very much, Dr. Chris Pockel, and we talk about this a lot. He's a boarded behaviorist out in Seattle, outside of, where is he, Seattle? Somewhere over there. I want to say Seattle, but difficulties going in the litter box, Portland, Oregon. It just hit me, Portland and Oregon. Difficulties going in the litter box. When I do some virtual care visits, which I hope you're doing in 2022 for your own mental health too, to make sure you're seeing things. But I like looking in, and I said, Dad, do me a favor, show me the litter box too. I want to see what it looks like. Does it have a lid? Maybe they're not truly, they just can't get into the litter box. And maybe that's why they're marking or so forth. So seeing that, going up and down the stairs, and I'll say that on my Zoom calls too, is like, can you show me what the stairs look like? Do you have a ramp? Do you not have a ramp? And then you see them doing the whole head bob thing. Maybe they're toe touching on a certain limb, pelvic limb specifically. What about decreasing playtime, limping, inappetence, restlessness? Those can also be behavioral signs of things too. So, it's important to decipher those things out. And you and I, we may have maybe 20, maybe 30 minutes on a good day that we have that ability to have that communication, get them invoiced, give them a proper diagnosis, and off they go. So it's difficult. So I'm going to show you some methods and modalities that can really help break this, bridge this gap, I should say. How about this quote? Doc, she's still eating and drinking just fine. I'm so glad she's comfortable, not in any pain. She's just getting old. Give me the number one if that resonates with you. Has a client or a pet parent have said that to you in some way, shape, or form, that they said, she's doing fine, she's comfortable, she's not in any, she's just getting old. She's just getting old. He's just getting old. So yeah, Jane, Lawson, Grace, Mary, all saying, I see the ones coming in. And it makes me scratch my brain and be like, huh, what do you mean? Like, especially in 2022, we have so many other great tools and modalities that are out there. And what I'm about to show you too does not have anything to deal with any oral medication, although there's a place, do not get me wrong, but these are some modalities that we can consider to help make sure that we come to terms in understanding that. But first, we need to know, and we need to understand and diagnose the of pain. What is pain? Because we're seeing this a lot that's happening in everyday practice too. So how do we know that? Okay, so let me see if I can just move on to the next slide here. Okay, so the physical exam. I'm going to say this twice. The most powerful tool that you and I have are our hands in the physical exam. It's the most powerful tool that you and I have is a physical exam. Can I get a number 8 up in here? Give me the number 8 if you agree with me. The physical exam, the physical hearing, auscultating, palpating, touching, seeing, looking, smelling, all those different things. There is value to the physical exam. I'm on TikTok, as you know, and I'll share that in a second. There was a video that really irked the you-know-what out of me. It was a pet owner that was making fun of a veterinarian about a physical exam. And what she did is she took her dog and she was doing this. If you can see me doing this, she's doing this, she's jingling the ear, she flipped the ear, she flipped the lip, and that was it. And then she showed the invoice of $462. And she goes, I paid for my vet to do this, to do $400. That just irked me because one, obviously there was probably a gap in communication, but the comments that were coming in from pet owners like, yeah, I don't understand why I just can't get a refill of my dog's ear medications or a refill of their pain medications. And so I didn't chime in because you and I know we can go to town on that. But just the fact that when I see those comments coming in, it makes me realize, wow, some pet parents do not see the value to what you and I are doing with that physical exam. So what are some things specifically? So let's observe from the entire hospital team, right? Oh my God, Sydney Tread, you're cracking me up. Wait, side note, look at all the names that just came in the chat. If you're looking at the chat, look at all the names she just gave me, and I'm stealing them, so don't delete the chat. I need to get a screenshot of these names. Thank you for this. So observations from the entire hospital team. I did a lunch and learn, a similar talk for the entire team. And comment down below, do you empower your veterinary team receptionists to kind of get an idea, especially with curbside, when they're coming out of the car, or when you see a cat going onto the exam table or whatever it is, do you educate your staff and show them this is what pain looks like too? The whole head bob thing that they're doing, maybe when they're coming out, or they're toe touching, or they're seeing that nail wear, or they're slow walking from curbside. Or if you see them outside in the parking lot, hopefully it's in the parking lot, not in your exam room or your waiting room, where they're doing number 1 and number 2, and you're seeing them subtle, just very, very subtle, squat low. And you're like, oh, is that something that's common? Is that, no, these are some things that we're seeing that we need to put into consideration when we start doing that physical exam. So the physical exam literally starts from the moment that they're getting out of their car, if you're still curbside, or when they're in that exam room and you're chatting with mom and dad, or whoever, and you're giving the side eye and you're looking at the dog's gait, you're seeing how they're interacting. So it gives you a good indication of things. Okay, has anyone heard of pain trace? Give me a Y for yes or an N for no. Have you heard of pain trace before? Okay, so you're gonna wanna take a screenshot of this because this is something pretty cool that I think is a great tool in terms of understanding how we can come to terms with identifying and quantifying pain for our pets that is a collaborative approach. Again, one more time, collaborative approach from both the pet parent's perspective and the veterinary healthcare team, okay? And so I do think that there's a great, and this is a lot of great data that's being done out here on pain trace. And what this is a wearable monitoring system that measures both acute and chronic pain. And so there's these two leads, almost like an ECG. One goes on the left side of the thorax, the other one goes on the right side of the thorax. They're using this on food animals, horses, dog, cat, and they're also using it on humans too. And so the company will provide you with a laptop or a tablet, if you will, and they will give you the materials that you need. So you could try it on yourself. Like, for example, like I slowly press, and the reason why I'm going to say this, I slowly press a chair on my foot. So I can, obviously it hurts, but you want to see it almost, it's going to look like these wave values that you can see where the pain goes. Oh yeah, they nailed it. So what this is, it's real time skin mounting sensors. It probably takes no more than 5 minutes to get it situated. They even have like a harness that you can have them wear it as well if you want to go longer on it. So pain, from prep to pain trace is about 5 minutes. And so what this looks like is what you're trying to find. So the negative, so think your brain on this side. So the y-axis is your positive or negative pain, and the x-axis are going to be your deflections that you're going to see for acute pain. So let's just say, and I'm going to show you an example, a dog that broke a toe. So that's going to be painful. Dentistry, post-op, pre-op, ACLs, end of life, palliative care, cancer. See where I'm going with this? You see, the list goes on. Do I know if it's time for me to put my dog or cat to sleep? I don't know if they're in pain, Dr. Christman. And very well be, and I'm going to say this really loud from the people in the back. You and I know that it's probably time for that owner to consider end-of-life care. But maybe, just maybe, hear me out, maybe we need to consider putting this monitoring system on them so we can actually show them, look, they are in pain. Because maybe they need that visualization to kind of, close that circle of life, if you will, for their animal. So I really have used that a couple of times. So I do think that this has value to it. And so this is a case that they've done this study on. It's of a beautiful greyhound, 6-year-old, 33 kg greyhound that presented with an inflamed digit of the left forelimb. So this is a dog that came in, left forelimb pain. Dog was found to be non-responsive to the veterinary exam. Well, let's just stop right here. Give me a yes or no. Have you seen, could we just talk about greyhounds for a second? I have seen more greyhounds that have come in with laceration repair, like skin falling off, an intestine almost hanging out on one of them too. And they're coming in like, hey, what's going on, right? And you don't think they're in any pain. Have you seen greyhounds that have had this before? Like there is like a stoicness behind them. And so, yeah, I'll tell you, I have. And so anyway, so what do? You put the pain trace on them, and it was utilized. It became evident that pain was experienced upon weight bearing. Sometimes you and I have a hard time in eliciting the pain. Gosh, is it the left front leg or is it the right front limb that they're limping on? It's really hard to get an idea. Well, now you have something that might be tangible for it, okay? So a long story short, they did a whole great study of it. They did a toe amputation because there was a fracture and non-union fracture, whatnot. So they did a little bit of a digit amputation. So this is what it looks like. So on your x-axis that you see are the course of over 20 minutes that this was on. And on your y-axis is the pain scale. Remember, the negative reflections or the deflections is what we're going to be looking for too. So I want to bring your attention to like 15 minutes and 40 seconds. And that's where the dog was not bearing, noted pain when the left foot was bearing weight. So, ow, that hurts, ow, that hurts, ow, that hurts. And then subsequently, you know how we overcompensate for things too. There was left shoulder pain, there was right shoulder pain. So the dog was compensating for that pain. So you can imagine, think of your CCL injuries, right? How many of them, if you're new to this, what the company recommends is like put it on the dogs that there's going to have some obvious pain. So you can see what those values are going to look like. So the classic are your CCLs for sure, because you will definitely see what that looks like. So, and then again, they did this in the post-operative component, and you can see that the dog was not nearly as painful post-op, which is great. The sensors were removed. So this also shows you something that's tangible and quantifiable. In other words, Dr. Christman, do I need to keep going with the pain medication? Sometimes you and I are like, nah, just give it till completion, but this might give you something a little bit further. Maybe we need to refill, some of the pain medications as needed there. So I think of your pre and post-op surgeries, chronic pain. And a really quick thing, this is the business side of me. You envelope this in the cost of your physical exam. Prices are going up, but something to consider to offset it. I wouldn't one-off this. I wouldn't single charge somebody on this, I would include it in all your physical exams too. You may not do it for everybody, but therefore you have that, the value, that price. And then what you're going to do, this is the social media guru in me, is you're going to showcase this on social media. You're going to do a video of this. You're going to tell clients and blast them all with this, that you have this system in place, because there's more value. That's the reason why I should go to your practice versus the other practice down the street. Okay, let's talk about thermal imaging. Next up, has anybody been thermal imaged over the past 3 years? Raise your paw. Say me. Have you had a temperature screening done? Comment in the chat box, say me. And I want you to write me, M-E-E-E-E, me, like that. Have you been temperature screened before? And chances are all of us have been. Lawson, you have not been temperature. Oh my goodness. Well, unbelievable. Well, Sydney says me. Yes, chiropractor's office. Jane, you haven't. Yeah, usually you have been at some point. You may not even know it, So let's talk about this one too, because what is that looking like on the person on the right too? We're looking at redness, heat. What does that sound like to you? That sounds like inflammation, right? So there's veterinary thermography that's also available as well. And this uses a really cool camera sensor. It's also attached to like a tablet. So your veterinary technicians or assistants can do these for you before you go into the room. And they look at thermal images that's looking at surface temperatures of the animal. So not so much of like, fever and those kinds of things. We're looking at inflammation, oral cavities. Are you having a hard time convincing a pet parent that there is dental pain? Well, I just showed you 2 modalities now that can really assist in identifying and recognizing pain. This is another one too. So Digitherm is the company that makes it. It's a software system, easy integration with your PIMS, but great tool, physical exam for acute and chronic pain. Should you continue to go on the gabapentin and non-steroidal anti-inflammatories, or should you start adding things in or be more proactive with the Assisi loops and getting those things on board? So I do think that this is another great tool. Again, what I'm showing you, my friends, are value tools. This isn't something that you can, these diagnostic tests are not something you can get online, but this is adding value to owners, whether it be in the virtual space, if you're doing, virtual care visits and follow-up, but really good value to your physical exam. So really consider those things. Okay, let's move on. Talk to me, yes or no. Do you, or what are you using, if any, for pain scores? Are you doing any pain scores? Comment down below. Yes or no. Do you have it as part of, say, like the physical exam, the body condition score, or the muscle loss score and all those things? So Nicole says yes, for sure. Okay, cool. And this probably is one that looks very familiar to you and I. Yeah, and if you want to get a screenshot of this, or you could just Google this one too and get this image. I think this is great. And you know who I love to do this with too? Are the children in the exam room, so they can identify and help me out, because I love to include kids as part of the physical exam if they're good and well behaved. But I really do like to get them involved and inspire them and all that stuff too. But I want them to see, hey, what do you think your dog looks like right now? So what we were just talking about, you see them every day. You play with them if you can. Where do you think your dog is at? And so they're like, well, it looks kind of like that number 3, Dr. Christman, or you know what, she really doesn't get up much. She really is laying down a lot, like the number 4. So, this is a subjective, but also quantifiable area too, where you can look at things. And I think this is another great lunch and learn opportunity to educate your whole team. Because if you have, Mr. Smith that's calling on the phone and they're saying to your CSR that, I think that my dog is laying down, crying a little bit. Should I bring him in today or should I bring him in tomorrow? Well, that sounds like a today kind of a visit. So let me see how we can get you fit into the schedule for that. So, those are really great things. Get these, put these in your exam rooms, do a social media play on this. Comment down below. What is your dog's pain score, if any, do you think they are? What were they if you had a dog? Really use this as your tool, because again, really adds value to your physical exam. And we just talked earlier about this disconnect that happens between our pet parents and us about pain. Now look what we're doing. We're really coming together so we can keep that pet parent in that driver's seat. You and I are in the passenger seat, not Thelma and Louise, but we're really driving to make them have those great decisions so we can enhance and then elevate that human-animal bond together. So I really do like this one. Okay, let's talk about our cat-tastic friends. What about our cats? So let's talk about this. So what do we have? Is anybody using the feline grimace scale? Give me a yes or no if you're using the feline grimace scale. Shelly says, yes, give me a solid yes, YASSS if you're using it. But if not, I love this one. Shout out to our friends in Canada. This is a great, great study. I think this is such a fantastic, and I've learned new. I mean, this is what I love about veterinary medicine. Everything I'm showing you is so cool and newer, you know? And so please teach your team about the feline grimace scale. Easy peasy. And guess what? Something is coming out on the horizon within the next couple of weeks. And so you're going to want to know for sure if you have cats that have pain. So, you know, OA pain, for instance, too. So let's look at these. And it's really easy. It's a 0, 1, and 2. Now, I never knew, and all my vet school did not teach me this, I'll tell you that, about whisker replacement. But, you know, understanding cats' ears and eyes, like you kind of understand. But like when you have a 2 and you have a vet assistant that's like cleaning out the litter boxes, and you have maybe you're doing a boarding facility and you don't even know, but you're educating your staff because you might have a blocked cat that looks like a number 2 on your right-hand side of your screen. And so that gives you a really good indication that, you know, we might have urinary blockage or about whatever it is. But, you know, I love this, like this cat on the 0 is just cracking me up too, because I feel like he's like, oh, what's going on? Where are we going? What's happening? He looks engaged. He's ready to go, you know? So, but look at the whiskers. Are you noticing those things? Look at the whiskers. So the whiskers are loose and curved on a 0, which is beautiful. And then on a 1, when they're a little bit, look how the whiskers are slightly curved or straight. And practice on your cats. This is another great tool that you can do to your audience you're following. You're building your community on social media, and your followers, you want to ultimately convert your followers to $ to be your loyal clients. And so getting them engaged. Comment down below. What is your cat's feline grimace scale number? You know, hopefully you want to say 0, but if somebody writes down a 2, you could DM them like, we'd be happy to see you for an office visit. So yeah, you can find this anywhere, grimace scale. It's fantastic. So I'm really, really big fan of this. Has anyone been doing this one too, the feline muscle condition scoring one? They have one for dogs too, but I wanted to make sure that we give a good shout out to our cats because, you know, they tend to be tougher in identifying pain. Now, we talk about cachexia. We talk about also known as like sarcopenia. Is anybody using this one too? Because you can also Google this one and get a nice image. Another good conversation piece, because think of your hyperthyroid cat. Think of your chronic renal failure cat, right? And then the owners get frustrated because they're seeing them as thin. And we know that protein is one of those things where they can lose muscle mass the most. So you're gonna look at, you know, the semitendinosus, semimembranosus muscles. You're gonna look at their deep epaxial muscles too. But this doesn't necessarily talk to you more about pain, but you're putting this in conjunction with the body condition score as well as the grimace scale. And that way you have a conversation too. And owners like to be aware of these things too. So yeah, so glad you're here, Mary. That's what we're all here for. We're always, when I do my TikTok live streams with pet parents, and I'm talking like this, comment in the chat box. This is what we're doing, my friends, is like, you're here to learn and we build community, and it just warms my heart. And as you can tell, I'm very passionate about this stuff too. So, but remember, cachexia, sarcopenia, remember, age is not a disease. You can have a perfectly normal cat that has beautiful blood work, normal ALT, ALP, you name it, everything's good, T4 looks good, but they're 18 years old. And they look like they have, you know, the cachexia, sarcopenia. So you want to make sure that their muscles are okay, their joints are okay. Are they comfortable? Are they arthritic? Is it time to put them on some sort of a modality? So that's what we need to consider. Okay, this is one that I don't use that I probably should start using a little bit more. Is anybody using the Feline Musculoskeletal Pain Index, also known as the FMPI? Has anyone heard of this one? Comment down below. This has been around for a while too, by painfreecats.org. I know this is used a lot in the fear-free area as well. I think it's fantastic. This is a clinical metrology instrument, and I think it's going to be used a little bit more once Silencio starts to come out a little bit more as well. But you know, you'll see that this is by NC State College of Veterinary Medicine, and so measures clinical features of a cat's mobility, agility, and disposition that are associated with chronic pain. Okay, so look up into, I'm not going to spend too much time on it, but I do think that's something worth looking at. You know, Mary's asking, do you feel we can ask owners to look at some of these if they are on the fence as to pain for their cats? Absolutely, Mary, because you know what, that starts, even if they're wrong, because they might be wrong, it starts a conversation. It starts the conversation to have that. You know, we as veterinary professionals are all about, well, they need to see your vet, they need to see your vet. We can't turn them away. We have a hard time with this right now. And obviously we know how busy we all are, but we want to make sure that our cats and our dogs are comfortable. So it's my general rule. You may disagree with me, but I always say if it's a concern to you, it's a concern to me. So even if I know that's a lipoma and I stick a needle in that and I look under the microscope and I see lipocytes, I still know that that's going to be benign. But I do feel that pet parents want to be empowered. I'll tell you this, my friends, I have almost 820,000 followers on TikTok, and almost all of them are pet owners, and they love this stuff. They are hungry to learn. They do not like being turned away from a veterinarian that tells them otherwise, because guess what they're going to do? They're going to Google stuff. So they want it to come from you, a credible source of information. So it's really good. So Mary says, yeah, it's good for a baseline for pet parents too. Thank you for sharing that. I love that. Okay, what about this, my friends? Have you done any work with this, with pet owner surveys? In general, do you have, like, somebody usually tells me at this time, like, ain't nobody got time for that. Because like, who has time for surveys? But is anybody doing surveys for like Senior at 7, something online? Or do you have any social media plays that you're using? Any websites, any email tactics that you're doing? Is there any of that you're doing to recognize? The reason why they talk about surveys is because it sometimes hurts. Like somebody said to me yesterday about my girl, Chelsea, she's 13 years old. She's like, oh my God, she's so gray and old looking. That like stings, right? That really stings. I'm like, my girl, I feel like I popped her right on my own loins, you know? And so I'm like, oh my God, my girl, somebody thinks my girl's old. And that's okay, because I love my gray muzzles. That's what it is. But then it makes you recognize things to make sure that, are they in pain? So look at these questions you see on the right here. And you could do this, and this is a great, I love team building exercises. It's a great one you could do for your hospital. So you can put one of these together too. And so like, you know, have the receptionists and technicians and everybody for once come together about something they can agree on with these things, and make one that everyone has their buy-in on. And so you can send that out, whether it be a day before, or, you know, it's just happy birthday to, you know, it's Chelsea. I see that she's 8 years of age. We really want to make sure that she's nice and healthy in her older years. Take this survey and see what the results are. I think it's good because it does help, again, to our points that we're just talking about in our chat here with our family today, is that it stimulates a conversation. It stimulates a conversation. Now, I wrote a book. I don't know if you know this. Does anybody have my book? Yes or no? Does anybody have my book? Because I feel like Oprah. I feel like I should be doing a giveaway right now. You get a book and you get a book. So, but I did write a book. So, because I wouldn't be a dachshund dad if I didn't talk about intervertebral disc disease. And so I feel like you and I, as veterinary professionals, we don't have enough time in our day, period, especially about something that could be terrifying as intervertebral disc disease. And so a patient of mine 14 years ago came into my life named Cosmo, and he was paralyzed in his hind limbs. He was T12, T13, and his owners just walked away, totally ghosted me, left him, and he became my baby. And I had him for 12 more years, my friends. I squeezed his bladder. He was permanently paralyzed. And this talk is an inspiration for my Cosmo, because all of us have a Cosmo in us, and all of our patients, that willingness to continue to live a wonderful, healthy life, regardless of their disabilities that they have. And this is a book that showcases client testimonials around the country, as well as some modalities too that are out there. And it's very digestible, lots of good pictures. I show you how to do the football player squeeze. Like if you have to squeeze a bladder, you know how to lean them over. If you have a boy dog versus a female dog, what does that look like to you? So I do encourage, it's only $14.99 on Amazon, but it's a good book to have in your waiting room to give out to clients. I'd be happy to autograph it. I used to have book signings before the plague hit, but I do want to give that a plug, because I do think it's something that is a necessary one to have, especially with our back dogs. So integrated pain modalities. I'm going to stop here for a second. I want you to go ahead and just blast it in the chat box. What are you using for your general acute and chronic pain modalities? And I'll give you an example. Let's just say, you know, shockwave therapy, acupuncture. So comment down below, what are you using for just a generalization? Like what are some things that you're using for your tactics? Is it, you know, acupuncture, you know, or are you not? Are you just solely on, and there's no right or wrong. I just like to know so we have an idea. Sydney says acupuncture, cold laser, and meds. Jane says massage. Very good. Nicole, I got you, Nicole. Acupuncture, laser. Lawson saying laser. NSAIDs, joint supplements, physical rehab. These are great. I love them. Angelique, yeah, clients underestimate pets' level of pain. That's amen. That's what we're talking about. Galliprant, NSAIDs, acupuncture, massage therapy, cold laser meds, recommends to PT. Love it. Tea relief, energy medicine, CBD, CBG oils. Yes. Just already ketamine injections. Excellent. Acupuncture, chiropractic, laser herbs. Assisi loop, meds, and acupuncture, laser. Excellent. These are all wonderful. Look at these modalities. Now, let me ask you one more time before I go forward. Comment down below. Do you think that pet parents are wanting to do more of these modalities than traditional? Yes or no? Do you know? So if a client's coming in and they're saying, what other options are there? I like to do laser. I want to do chiropractic, to Jane's point here. I want to do CBD. I don't like to put my dog on a drug, Dr. Christman. Do you find that more like the pendulum has shifted? The research is showing the Gen Zs and Gen Xers are going 100% towards what we're talking about. So, but it's mainly financial constraints on holding back, Sydney. I agree with you on that too. It depends on the general token I found. Mary, yep, yes, and yes with horse owners. Thank you, Jane, for sharing that too. So yeah, it's so interesting that we need to be aligned with that. So agree or disagree with this statement, my friends. I prefer a multimodal approach to pain management. Comment down below, agree or disagree. Mary says, I have people who want to get some relief for their pets with the least side effects. Yeah, it's true, because to every drug that we take, there is, of course, some potential side effect too. Shalice says, agree wholeheartedly. Lawson saying, agree. Nicole's imperative. Yep, Mary, agree. Yeah, and I mean, there's no right or wrong to this, but I think in 2022, what we're dealing with now is that, there's so many different approaches to treating a dog. And I say this all the time, like, I tell my clients, like, I'm a veterinarian, not a vaccinarian. I will customize a vaccine protocol that's best for your dog. Like, yes, I'm going to recommend lepto and bordetella influenza if you have a very active lifestyle. If some of my clients in the city, dog never leaves a high rise, never goes outside, whatever, less likely we're going to talk about leptospirosis. And the same thing goes for these modalities. It's a customizable approach. And that's what I love about veterinary medicine in 2022, is we really learn to customize these things now, because there's so many options. And so to your point, everybody's saying, yeah, it worked. Everybody works differently. So we talked about some of the modalities that were used in acute and chronic pain. So let's talk about this. Yes or no? Is anybody using the Assisi loop? I saw one of our friends in the chat said yes. Is anybody using the Assisi loop, or have heard of the Assisi loop at least too? Comment down below. Let's see what we got. Okay, Jane saying yes. Sarah says yes to Assisi. Sydney Trans heard of it, not used it. Okay, cool. That's what we're here to learn. Yes, on my three-legged cat. Oh my, Jane, if I couldn't, can you all friend request me on Instagram too and follow me, because we need to hang out. I love all of you already. Yes to Assisi Loop Lounge and the Calmer Canine. Grace, my gosh, I'm gonna give you a high five. Get your paw up. 1, 2, 3, 4, 5. Boom, high five you. Heard of it, work with food animals, so not real practical. Perfectly fine. Thank you, Sally. Heard of it, but not. Okay, so hey, okay, total side note, this is gonna date myself, so I might be older than most of you probably. But do you guys remember Romper Room when it was on? Does anybody remember Romper Room? They never said my name, Adam. I don't think they did. So it was a show back in, was it the 80s, was it? I think it was the 80s, right? And she would hold the loop up and she'd be like, I see Mary, I see blah, 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 And I'm like, she never said, anyway, this is CC Loop reminds me. Was it way before the 80s, Jake? Gosh, don't date me like this. Oh my gosh, you started in the 60s, Susan. Oh, Dr. Susan Wagner. Is it the Susan Wagner that I know? My gosh, that works with us. I didn't know you're in the room. I think you talk about noise, the music therapy. I got to give you a shout out, because if it's Dr. Susan Wagner, the neurologist, huge in integrative medicine, and I listen to your talks too on music therapy and neuro. So anyway, I got to give you a shout out if it's the Susan Wagner that I think it is. It is. Oh my gosh, I'm sweating. She's here. She's here. Love you so much, Susan. Thank you for all you do. And the calm movement too. If you don't know the calm movement, reach out to Dr. Susan Wagner. It's a great thing that's happening in vet med. Okay, so the Assisi loop decreases pain and inflammation, accelerates healing in the soft tissues and bones, and decreases or eliminates the need for pharmaceuticals and opioids, as well as works with other therapies. This is great, my friends. I don't think I can find many things out there with negative side effects too. Love you, Susan. And so, all of my IBDD patients have this too. It's the standard of care. They get the Assisi loop. And I have 2 dachshunds, my 2 smooths right over my shoulder here. There they are, Chelsea and Connor. Before we go to bed, they have the Assisi loop on, and I think the session is 8 minutes, and it's fantastic too. It helps decrease pain and inflammation. So, And so, yeah, it works on multiple animals too. So how does it work? So it's targeted pulse electromagnetic field therapy, so TPEM. So it helps decrease the anti-inflammatory cascade. So, and it has a whole thing about nitrous oxide too. It enhances nitric oxide, the body's own anti-inflammatory molecules. And so Dr. Tim Crow, if you don't know who he is, you should. He's a wonderful colleague of ours in the industry who has taught me a lot about the Assisi loop and hyperbaric oxygen therapy. But he also, like me, suffers from migraines. And I know I can say it, but Assisi can't. It works great for migraines too. I literally put it on my head and it's amazing too. So yes, any comments of canine light therapy 15 minutes per pen with the Assisi loop? Yes, to both of them. You could do that too. We've been using it on a burn patient, Lawson says. That's fantastic. Thank you for sharing that. So your wounds too. I know that there hasn't been, I guess we don't know just yet about the fovea with Assisi loop. I'm sure, I don't think there would be any reactions or cross reactions to it, but we just don't know. So I did get a question about that last week. So, but stay tuned. And I know somebody said the dental loop, one could potentially stick their own sore arm through it. Yeah, absolutely. I'm telling you, it works really good. Like if you have bad knees, I mean, you're in vet med, so you know you and I got bad knees. It works really good on your knees too. So get one. I'll tell you. Get, like, literally, I put them around me. If I could put 30 hula hoops around me right now, I would. I need them. I make myself laugh, the stuff I say. Okay, so the dental Assisi, it's smaller too, but look at this one. I don't know if you've heard of this one that's out. This is new, but this helps reduce oral inflammation. Think of like your feline stomatitis, and I know I shouldn't say the word fasciitis because Dr. Jambellos taught me another word, dentist, but it's not that. But anyway, when you have those cats that have to do like full mouth extractions and whatnot, this is a really good one. You know, you have the upper fourth carnassial tooth that you got to take out or whatever on dogs or anything like that. Helps reduce inflammation caused by stomatitis, reduces the healing time. This should be part of your pain management protocol. I'm telling you, pet owners are going to want to do this. They want to. You usually giving them like the Buprenex or whatever you're trying to do for pain management, which works great. But then they want to be very proactive and they really want to feel empowered. And this is a great tool. I can't say enough wonderful things about the Assisi loop because I think it's great. And like, of course, the Dachshund. Now, you don't have to stick a Dachshund through there, although I feel like the Assisi loop was made for Dachshunds, so it could stick through for spinal injuries. But you can lay it on top too, okay? And so you can go on the website to learn more about it and find out more. So congestive heart failure, CRI that can have dentals for chronic management. Yes to this. I've had dogs that I've given the Assisi loop on for that reason. You know, to the 17-year-old dog that just cannot go under general anesthesia, but we got to decrease that pain and inflammation in those gums. Let's do the Assisi loop. It's not going to harm them too. Please tell them about the carrier that I stick the cat in the loop. Oh yeah, and the carrier. Yeah, you could do. So James, you put the cat. Let me see if I'm saying this right. You put the cat in the carrier, and then you stick the cat in with the loop in the carrier. Yeah. So she puts the cat in the loop, and then the cat in the loop in the carrier, so that way they're confined for 10+ minutes, so that way they can get the therapy they need. Brilliant and brava, Jane. So love it. Thank you for sharing that, my friend. Here are some other things too. Brain lesions, ear infections. Look how some smart pet parents, like the one with this cone of shame, they actually have it taped around, and it doesn't make a loud noise to their ear or anything like that too. There's a carrier that holds the loop, and you just stick it to the ill-behaved cat. Oh, thank you, Jane. Yes. Maybe dumb question. Do they require an RX, or can the owner just purchase it? It's are they very expensive? I'll say they can purchase it online, and it doesn't require a prescription. And price-wise, I don't think it's expensive in conjunction with the amount of sessions that you get out of it. So I'm going to have our girl at the end talk more about that to answer that question too. But these are some areas that you can use it on as well, okay? And orthopedic, degenerative disorders, neuro, wound care, just what you were talking about. Okay, because I know many of you have hyperbaric oxygen therapies right in your treatment area. So comment down below how many of you have had, just by personal experience or patients that you've referred. Has anybody have any experience with hyperbaric oxygen therapy, HBOT? So certain practices, this is St. Francis Animal Hospital, for instance, it carries that. So it's about $300 for 150 treatments. So at $2 per session, less expensive than laser in the clinic. Ideal to do both. Thank you, Angelique, for sharing that. Thank you so much. So Marianne says no to hyperbaric oxygen, no experience. Lawson says yes, but only in specialty clinics close by. Yeah, so I mean, anybody had to deal with a snake bite lesion? or a dog or whatever, you can refer them for this. It's like works amazing too. So the results have shown that this treatment is effective in curing inflammation from snake bites, of arthritis, infected wounds, helps tissues in the body, help in the healing process. So like so many other things, but let's keep it for real is what I say is like, it's hard. I mean, we talk a lot about access to care. It's hard to even find a veterinarian in X amount of miles, let alone an hyperbaric oxygen therapy. But I do want to keep that on your radar because it is something to consider if it's available in your vicinity as part of a treatment modality. I think it really has its place. Okay, what about Sunovetin? Has anybody heard of Sunovetin? Yes or no? Comment down below in the chat box too. Has anybody heard of Sunovetin? I got a silly dad joke for you in the meantime while you're commenting. This is a little boy taught me this while I was auscultating to his dog. And he said, Dr. Christman, why the chicken cross the road? I go, why? He goes, because. You can steal that one. You can steal that one, everybody. Okay, so let's see. Have heard but not used, though. We are working on the licensing for it. Yes, but not used. Okay, so let me just, I got to get a picture of this too, because that's always good to hear. Thank you very much. Okay, so Jane, it's a good one, Jane. You can steal that one. It's a good one. You're welcome. And how do they treat the kleptomaniac? He took something for it. You're welcome, Jane. If I had a mic, I'd drop it right here. Okay, so let's talk about Sunovetin. So this is a once-a-month injection that goes in the elbow. It's a radioactive isotope. It's classified as a device in the elbow for 1 year for treating arthritis in the elbow. Now you're probably thinking, wow, that's so specific, Adam. Like, how is it going to be successful? Well, on label, it's for elbow. Now they're getting conditional licensing for other joints. I know the state of Ohio, if you're out there, they're using it for other locations. Game changer. If you go to the YouTube channel to watch the before and after pictures, this poor golden retriever that had elbow dysplasia did phenomenal with it. Jane says, okay, we are so done. Okay, I'm moving on, Jade. I got you. So 12 months of relief, outpatient intra-articular injections. Does anybody do know how to do an intra-articular injection? Yes or no? Comment down below. I can't. I mean, I've sat in a wet lab. I mean, I probably can. I just don't do enough of them now that I'm part-time. But I mean, you go on the medial surface. Dr. Matt Brunke is fantastic at teaching you how to do it too. If you stay tuned, by the way, we just filmed. Did anybody know that I have a talk show too? It's called DVM 360 Live. I'm putting it in the chat for you all too, because you're going to crack up. I just put it in the chat. It's called DVM 360 Live. It airs on dvm360.com. You got to watch the show because the fourth episode is going to talk about Sunovetin in this injection. And so you'll learn more about it as well. But this is an injection that helps decrease inflammation, the inflammatory cascade. And so it works by using tin 117. So we've heard of, radiotherapy with, hyperthyroidism, for instance, too. It's been around. Now, I know someone just said in the chat too, working on licensing for it, Shali says, because you need to have the radioactive, it varies by state, the wants and needs of radiation, of course. So that's where it is. So it's a little bit of a challenge in that regard too. So I think the harbor is trying to prevent adding bacteria to joint. Yeah, that's true. It is what's doing a joint injection too. So remember, always a synovial disease. So it's an injection that's used for that. I know that the dog cannot be in the bed for 14 days, I believe. So 2 weeks away from the owner. So it's almost similar to like how it was like when they go for radioactive iodine treatment for cats, but just for the dog, there's that. I don't think you have to worry about, don't quote me on this too, but like, pee and poop, I forget, again, I was zoning out when he was talking to me, story of my life, but I don't think you need to. So, okay, shockwave therapy. Let's talk about this. Does anybody use shockwave therapy? Comment down below in the chat box. And when you think of shockwave therapy, you think of like this, right? You think of like, oh my gosh, like what's happening to me? I'm gonna get a shockwave, what the heck? But it's not. So when you think of like lightning coming through, you think of like sound waves or whatever. Yeah. So yes, hoping with next year's budget. Absolutely. I think, again, I think it's definitely something that's worth looking into. I think it's a great modality. So, and what it is, and this is by PulseVet by Zomedica. And so they have positive results in improving bone healing, soft tissue damage, joint inflammation, conditions that can be treated for hip and elbow dysplasia. It works amazing. And this is a movable device. So I see we have some horse vets that are in the room too. It's really, really great, my friends. So I think it's something to definitely look into. Oops, my goodness. And that's what it is. It's high energy sound waves that penetrate deep in the affected, stimulating cells and releasing healing growth factors. So I think I have a video of it, but I don't know if it plays. So let's see. Let's see if it plays. Hold on. Let's see. I'm gonna skip these. Lots of studies are on it too for chronic pain. Okay, let me see if this video works.
Just like ultrasound. And I always start it out here, right?
Okay, I don't know. Did you hear that? Did anybody hear it? Yes or no? Can you help me out and comment down below? Sometimes it plays, sometimes it's like, could you hear what she was saying? Yes or no? Okay, so you heard the noise that it was making. And so you may initially be like, oh my gosh, how does a dog like sit through this or whatever? It doesn't bother them. And I see when they come to our practice with it too, you're surprised, you really are. You can't hear her talking, but yeah, she was just talking the fact that like the noise, this dog was not sedated. So they just used a little bit of a gel to increase it. And again, it's using the sound to help increase. This was a ligament injury. So let me see. I think there's another video I have too of it. Hold on. Here's another video. Is it comparable to the sound of Doppler? No, I think it's louder. So Leslie says it's super loud, and with our demo of the unit, we had several dogs that reacted negatively to the sound of it. So, thank you for sharing that, Leslie. It is something to consider, of course, but there's a modality for it. So in case somebody's asking about it, you know about it, you can make those decisions accordingly. But I do see what you see the list in front of you. I think of the lick granulomas, for instance, too. I know some of you do laser on it too, but I see better results with shockwave therapy than I do with laser on it, in my experience, at least. I mean, I'm not aborted anything, just a GP, but like, not just a GP. I am a GP, is what I should say. But osteochondrosis lesions in all those different areas as well. Okay, how the experience with cats and the noise. Actually, not bad either. So, if it's somebody to direct your attention to is Dr. Jennifer Vitucci, who you just saw in that video. And she said too that the cats do very well with it. I mean, of course, noise is noise, but I think that maybe when they're in the clinic or whatever, sometimes it's not as bad, but they demonstrate it too. So if you come to our Fetch conferences, plug, they will be there demonstrating the unit too. So we're going to be in Indianapolis next month. Who's going to come to, do you want to come to India? What did I say? Like, do you want to come to Indianapolis? But you got to come with us. We're going to talk about it too. You can use it with wounds, animal on wound. Yes, you can, Mary. You can use it on that too. Okay, so let's talk about acupuncture. Do you recommend or have experience with acupuncture? Yes or no? We're just wrapping up right here too. So our last couple of modalities here. So yeah, one of my good friends, Dr. Chris Shapley, he's a veterinarian of ours too. Dr. Wagner, you better say yes. I know you, right? I love her. And so the acupuncture works great. And one of my colleagues, Dr. Chris Shapley, he has a dog that he's treated. And it was one that I referred to him that he actually took the dog off. It was only on food and acupuncture for IBD. Pretty impressive, right? So, but there's so many different things too. Mary says, work with house calls vet that did it in the homes. Yeah, we used to offer it. But now I send out pets for it because it's amazing. Thank you, Shalice, for sharing that. Grace says yes, and so does Susan. So yeah, it really does work great. You talk about the meridians and all the uses and all that stuff. I think it's wonderful. Okay, so in summary, there's a lot of newer tools to assist in identifying pain in our patients. Use them. Nicole Schwinkerdorf says, yeah, it's great with feline GI issues as well. Thank you for sharing that. Yes, I know acupuncture is great with those things. So remember, add that to your tool, your arsenal. I just showed you a whole bunch of tools of that. Did you like this, by the way? Did you like some of the things that we just talked about? Comment down below, like, yes, this is amazing. Yes, your energy is amazing. Yes, we need to hang out. Yes, we need to have some fun. Because I'm very passionate about this profession. I love it so much. Incredibly innovative modalities that are now available for pain management. Use them. Pain protocols with traditional and Eastern medicines available. Use them. Don't be afraid. If you have a client that comes up to you and shows you a list from a previous veterinarian that used some herbal remedies or some homeopathies, don't shut them out. Say, let's figure out how we can work together. I think this is great. I'm not competent enough, but I know somebody who. We are so connected in this profession that we all know somebody who can help us with those things, right? So we have to embrace those innovations, embrace those modalities together. And that's how we move the needle of veterinary medicine. Pet owners want to provide non-invasive advanced treatments to improve their pet's quality of life. Use them. I showed you the pain trace aspect before as an example. We talked about the thermal imaging. Use those modalities because these are some difficult conversations that you and I face every day in practice. So we want to make sure that we're aligned, especially with our pet parents. And the ability to offer a clinically proven, safe, and sedation-free treatment for many difficult cases will set your hospital apart from the others. So try them, try them. You know, a lot of these modalities these companies are willing to like offer you their services complimentary to see what you think. You know, how does it work with your workflow efficiencies? And, you know, if it's not for you, then it's not for you. But the only thing you got to do is just friggin' try it, as we say in Jersey. You know, I'm from Jersey where we don't pump our gas, we pump our fists. Yes, Jane says Silencia. Absolutely. Silencia will be coming out very soon as well. So stay tuned for that. I know that. Jane, I'm not done. I got more silly dad jokes for you too. But I'll encourage you to, are you all subscribed to us on DVM 360 magazine, the publication, the big one that comes in the mail? Where is it? Right here. I have it right here. Yours truly is on the cover of this. I don't know how that happened, but I'm on the cover. But yes, we need to discuss dose, Jake. Help. Yes, so this is the DVM 360. We'd love to have you if you're interested in writing an article. If you want to be featured on our podcast too, called the Vet Blast Podcast, we'd love to have you. We have our Fetch conferences. We have our new one, a therapeutic area on pain management. That's going to be a weekend symposium with our friends from the IVAPM, International Veterinary Association for Pain Management, will be with us June 23rd and 24th in Indianapolis, Indiana. We'd love to see you there. And as a thank you, I'm going to put a discount code in the chat for you if you're all welcome. You're all welcome to come. And I'm having a brain fart on the discount code. But wait, hold on. Let me see. I got it. It just hit me. AS15. So Directions of Veterinary Medicine, Dr. Aaron Smiley is our keynote speaker too on virtual care, and that will save you 15% off registration. We'd love to see you there. And I want to thank our friends from Assisi for having us today. This was a lot of fun. Thank you for sharing your time out of your very busy days with us. And I know what it's like. Definitely follow me on some of my socials. We can hang and have a great time.